due to a busy, stressful lifestyle and the high cost of healthcare, many people are unable to or do not prioritize their health needs, thus failing to detect early signs and symptoms of preventable medical conditions. To highlight this, medical practitioners have for so many years been recommending that due to factors such as age, gender, family medical history and health status, one should have at least one annual general medical examination. But what does this entail and what should one expect? Well, to give us these answers, we joined virtually by Dr. Michael Mol, who is a Healthspan Physician. Dr. Michael Mol, a very good morning. Thanks for joining us. Welcome to Morning Live.
Good morning, Sims. Thank you for having me. Have you had your annual health check? I mean, it's what, the 6th of January. Have you done yours yet?
Good question. Now you make me feel bad. I actually didn't. And after this conversation, I definitely will make an appointment. I'm definitely making an appointment with my doctor shortly after this interview. And many of us only go to a doctor when we are sick or have a worrying sign or symptom of a medical condition. So when we talk of an annual physical checkup, what does this entail?
I'm so glad you said that, Sims, and that's such an important point. An annual physical health checkup is not only when we feel ill. The whole idea is that you go and see a doctor when you're not necessarily feeling ill. Let me give you a personal illustration. I get my name from my late uncle, Michael. He was a medical doctor. He was driving back from the hospital, medical student, age of 23, pulled his car off on the side of the road, massive headache, stroke, died. I was born a year later, took his name, and that's why I carried on with medicine to finish what my uncle Michael started. But the reason I tell you that story is at the point of his death, he had no idea there was anything wrong with him. He had something called malignant hypertension, really, really high blood pressure with no symptoms, and that's why he stroked. Now, the only way to pick that up is by having your blood pressure measured. And if you don't do that, you're never going to know. And there are no symptoms. That's often why high blood pressure or hypertension is called the silent killer. So to get back to your original question, why should we do an annual health checkup? We should do it every year, regardless of whether we feel good or bad. We should do it to know our numbers because of this fact. Just because you're not sick doesn't mean you're healthy. Health is not a default setting. It's something we need to proactively pursue and keep checking up on. So annually, physically, I would check your blood pressure. Most importantly, I would check your blood glucose because of this thing called diabetes. I would check your weight. They do something called BMI, body mass index, your weight versus your height. I think waist circumference is probably more important than BMI. But those are all measures that we put in place just so we can know our numbers, so we can track progress, so we can see if there's anything potentially wrong. Again, high blood pressure is a huge killer. In this country, 1 in 3 South Africans, 1 in 3 have got high blood pressure. And of those that, of the 1 in 3 that have high blood pressure, only half of them know they've got it. And the half that know, only half of them have got it under control. So, I mean, South Africa, guys, blood pressure is so key. If you haven't had your blood pressure checked in the last year, please do it now. I mean, Sims is going to make an appointment with his doctor right after this. You should say, or go to your clinic or go to the local hospital. They'll do that for free.
And Dr. Mol, I mean, some medical conditions don't present with physical symptoms. You just mentioned, you just christened it a silent killer. So when should one consult their doctor?
Well, annually. So that's why we're talking about this today. But I think if you have any significant changes to your day-to-day, so if you're suddenly feeling a little more tired than usual, or your sleep patterns are a little out of whack, or you've started picking up weight or losing weight, if there's anything that's just out of the ordinary, that's worth going to just check up with a doctor or a clinic. But I wouldn't even wait for those symptoms. I really would put it in my diary, make a point of doing an annual checkup. And whether it's in January or whether it's over your birthday, just pick a date in the year that you kind of say, I'm going to commit half a day, or sometimes it's even a day. You've got to take a day off work, but just to go and measure all these numbers, make sure that I'm in good health. And if I'm not, man, so important to know that so I can do something about it. A lot of people just don't want to have the checkup done because they're afraid of what they're going to hear. But that's crazy because you want to hear if something is going wrong because you can treat it early, you can do something about it. Cancer, for example, most cancers can be treated if we detect it early. And the only way you're going to pick up those cancers is by doing a checkup. So by all means, in fact, while we're on the subject of cancer, prostate cancer, particularly for Black African men, and I say that because the lifetime risk for men for prostate cancer is around 1 in 26. But for Black men, it's 1 in 5. And the chances of you getting it is you get a more aggressive form of prostate cancer and you get it early. So amongst the Black men in South Africa, you guys have to have your prostate tested. It's a PSA test. It's a blood test. No gloves involved, no awkward assessments, just a simple blood test. And from the age of 40, you should be having that every single year.
And how can people balance the demands of work, family and personal life with the need to, have a regular medical checkup?
Well, Sims, I mean, that's a great question. But once a year, I mean, one day, one half day out of the year, that could have implications for a lifetime of productivity. If you don't pick up the fact that you have diabetes, for example, and you just continue living as you are, and suddenly there's no energy, suddenly you're picking up weight, you just can't work because you normally worked, you're unable to be as productive as you were, and you could have prevented that just if you'd checked up earlier. I mean, if you think about diabetes, very basically, let me scare you for a moment. As a normal individual, we'll eat food. That food is then converted into sugar or glucose into our bloodstreams, and then insulin, a little hormone from our pancreas, is released, and that insulin causes glucose to come out of our bloodstreams into our cells, where our bodies use it for energy, for everything, for living, breathing, walking, etc.
Right.
That's normal. If you're a diabetic, or if you're pre-diabetic, you don't have enough insulin, or your cells are not sensitive to insulin, and so you can't get that sugar out of your blood into your cells for energy, for living. Now, that's one big issue. The other big issue is having a lot of glucose in your bloodstream. So, for example, and this is the terrifying part, here's an illustration for you to give you an idea of what sugar does to your arteries. If you were to gather some kids around, for example, you give them a life lesson. Say, kids, come around, get yourself some coarse grade sandpaper, some towels, roll up your sleeve and start rubbing the inside of your forearm with sandpaper. I mean, just stay with me in this. What? Yes. Stop, blow, let it dry. Keep rubbing. Now it starts to bleed a little bit and you're getting some plasma coming out, and you again stop, blow, let it dry, start rubbing again with sandpaper. And the children you've gathered around you are now freaking out and screaming and yelling, what are you doing? That's when you say, kids, this is what sugar does to the inside of your arteries. That's why diabetics are losing eyesight and limbs and kidneys. It's a terrifying disease. So you really don't want to get diabetes. And you can prevent it literally by knowing what your numbers are, knowing where your blood glucose is, and then monitoring lifestyle changes to adapt to that. So please, guys, blood pressure, absolutely once a year. Blood sugar, absolutely every year. And then weight, BMI, the stuff we talked about earlier.
Of course, yeah. And I'm actually glad you touched on the issue of lifestyle, lifestyle choices. And what role do these lifestyle choices, such as, exercise, diet, stress management, play in the overall picture of a person's health? And how do medical examinations help in identifying areas for improvement?
Well, I'm glad you mentioned exercise, Sims, because take diabetes as an example. So when we exercise, keeping in mind the importance of insulin and sugar being absorbed into our cells, when we exercise, our body is able to absorb sugar out of our bloodstreams independently of insulin. So that, for one, protects us from diabetes, but also if you have diabetes, allows you to get that sugar out of your system into your cells just through exercise. And that little effect lasts for 24 hours after every bit of exercise we do. So that alone should be a reason to exercise every single day, because it protects us from diabetes. So vitally important. But as far as lifestyle modifications are concerned, that annual health checkup, important, but it's three things really. It's eat, sleep, and move. Move as much as you can. That's exercise. Sleep 7 hours minimum. Anything less than that, and your body just doesn't have a chance to recover. Not your brain, not physically. And then eat less junk food, more whole food. Those three things: eat, sleep, move. Those are the pillars of good health.
And I suppose that's just one facet of, the whole conversation around a person's health. And another element of a person's health is, of course, the role of family history and personal health goals. And how does one's, family history affect the importance and frequency of medical checkups?
Well, it's vitally important. If you have a history, for example, of cancer or hypertension or diabetes in your family, you should be even more aware of your risk because you have a higher risk, and even more reason why you should go annually for that health checkup. Cancer is another one. In fact, when it comes to additional checkups, now we talked about the basics, blood pressure and glucose and cholesterol, but skin cancer is something that really can be prevented. Now, skin cancer is the only cancer we can see, and therefore we should never miss it. But we don't know what skin cancer looks like. So if you have access to a screening or a clinic, or if you have access to a dermatologist, that would be amazing. But that's an annual checkup that's worth doing for every person, particularly with fair skin, but also amongst our darker skin brothers. The skin cancer affects everyone. So there's something that's really worth doing as well in terms of next checkup. Vision is key. Dentists are going to give me a phone call and say, you didn't mention dental checkups. Absolutely worth doing. It really is. Prevention is way better than cure.
Indeed.
In fact, and the reason we do that, Sims, if I may, just quickly, is we don't necessarily want to extend our lives. So the idea, and it used to be like that in the olden days, I was taught as a doctor, we want to extend life. But the new thinking is not lifespan, but health span. So I don't just want to live long, I want to live well. So the average life expectancy today is around 73. The average health span today, those are the years that we live without disease and disability, is 63. So for 10 years, between 63 and 73, the wheels come off. It's hard. It's a difficult life. It's a struggle. Now, you want to be as healthy as you can be, and you don't want to necessarily live longer, but you want to narrow the gap between health span and lifespan so that all the years that you do live are good, healthy, vibrant, energy-full years. And we do that by looking after our health and being preventive with our healthcare, making sure we don't get what's coming down the road by checking up regularly.
Dr. Mol, I'm actually glad you made the distinction between living longer and living healthier, because now you've just opened our eyes to that difference. And I certainly hope that our politicians and officials are watching so they could know that the high cost of medical checkups actually hinders or scuppers people accessing comprehensive medical examination. Thank you so much for joining us, and thanks again for reminding me to make that my doctor's appointment.
You can always call me, Sims.
I've got your details. Thank you so much, Dr. Mol. Have a great one. Well, that is Dr. Michael Mol, a Healthspan physician, talking to us about the importance of prioritizing your health and having an annual medical checkup.